We are particularly excited about today's conversation because it is tackling a new and emerging field in CalFresh, which is churn. We have terrific experts on this subject from our state of California, the county of San Francisco, and the state of Idaho. And I have to say we were pleasantly surprised. More than 125 people from across the country signed up to hear all about churn and CalFresh. So let me quickly tell you, I'm Kim McCoy-Wade, and I have the great privilege of coordinating the Alliance to Transform CalFresh. Next slide, please, Austin. Which is a roundtable of 7 anti-hunger advocates in California, the California Association of Food Banks, which also serves as our convener, California Food Policy Advocates, Western Center on Law and Poverty, SF Marin Food Bank, Los Angeles Regional Food Bank, Catholic Charities of California, and the California Family Resource Association. We came together in 2011, frustrated like probably everyone on this call, with CalFresh participation rates and decided to set an ambitious but achievable goal of 75% participation among eligible Californians by 2016. And we decided to focus on 3 things: the consumer experience, data-driven outcomes, and statewide excellence for all consumers. Next slide. When we drilled down on that strategy of 75%, 3 strategies really jumped out at us as providing the greatest opportunity for the greatest growth. Number 1 was maximizing the ACA Affordable Care Act opportunity and sign families up for both food and health coverage. We had a webinar about that in June. Today, we're going to focus on this another new strategy, which is reducing churn, where families who are eligible come off the program and then come back on, usually for administrative reasons, not because of any change in eligibility. So we'll be talking about that in great detail. And just previewing our 3rd strategy, looking not just at the timeliness in terms of minimum requirement of 30 days, but really driving towards same-day service for most folks most of the time to try to get people through the process and connected to food as soon as possible. So with those 3 strategies, we are diving deep and partnering with the state and the county and the advocates. Next slide. Today we're going to focus on churn, and before we get into it, I just want to point out 2 things. First, everything we're going to talk about today is going to be posted on the Transform CalFresh. We've created a zero churn page where you will see this PowerPoint, a recording of this webinar, a fact sheet, some handy graphics, and lots of materials we've tried to pull together on churn. Next slide. And here are the people you're going to be hearing from, both so I can introduce them and so you know how to track them down with your questions, and I'm sure compliments afterwards. We're going to hear from Linda Patterson, who I'm sure everyone on this call knows, who is the chief of the CalFresh branch at CDSS and leading the charge. Tiana Wertheim, a senior administrative analyst at CalFresh in San Francisco County, doing great innovative things. And Greg Coons in Idaho, who is gracious enough to join us. Idaho has also taken the plunge on churn and tried to really figure out what's going on and been a great colleague to us in California. So I'm thankful for the work that all 3 of them are doing and for their time this morning, and I'm going to get out of the way and let them take it away. So next slide, and Linda.
Well, good morning, at least to everybody in our same time zone, and good afternoon to everybody else. As Kim said, this emerged as a big issue for us, and when you may want to ask, why would we, next slide please, why focus on churn? You know, it's not like we don't have enough other federal measures that we have to meet, but it's a particularly problematic area for us that was identified through our participation. We're doing very well on most performance measures, but definitely participation was not one of them. You know, we have to use data that's 3 years old from the feds, but as of 2011, we were behind, not only behind, we were last place. And believe me, I'm not happy with last place. So I know we can do better. The data from 2011 shows that only 57% of our eligible population were on our caseload. The national rate was 79%. You know, and then when we kind of looked at some of our efforts, one thing that we noticed, we've got a lot going on in outreach. However, on the other end, where we were losing a lot of people is the people that kind of either churn off, or the churn problem where they're going off and they're coming back in. And what's kind of the issue with that? So one of the reasons that we wanted it is, first of all, we want everybody that's eligible to have access to the program. That's number one. But number two, when they go out and then they're discontinued, then they have to come back and reapply, it's increasing the workload on our end. So time we could spend on other activities that would help in our caseload, we're not, because we're dealing with these churn cases. Our clients are frustrated. So they went off, now they're back reapplying. It's not a good public service for them. And additionally, administrative costs. This is costing us a lot of money. And, as we all know, we all participate in the costs on the administrative side, state, county, and fed. So that's something that we really felt that we could tackle. So, next slide. So we were looking at overall raising our participation rate because we are very dedicated to this. So we worked with counties. Our counties always have great ideas, as I'm sure you'll see with Tiana's presentation in a minute. But we talked to all of them, like, where would we focus our energies? And one was obviously with the ACA afforded a great opportunity to kind of partner and identify if they're on Medi-Cal, could they be on our program, and vice versa. And I think we've made a lot of effort in that. One was we had terrible participation with seniors. I'm proud to say in the last 2 years we've already increased their participation by 53%. But then we also really wanted to address the churning. So next slide. When we talk about churn, it was kind of funny to me that there wasn't really a definition out there. And so what does that mean? And I was lucky enough to talk to Idaho, who really helped us with this, because there's not a lot of states doing much with this. I think Washington was doing something, but they didn't want to really they share that publicly. So Idaho was a very good partner in this. So how we define churn is that we do two measurements. One is reapplication. And I'll kind of explain this in a way that makes a little bit more sense in a moment. But basically it's how many, for this example, I'll say visualize your lobby. And we know obviously many come in online, but visualize your lobby is full of 100 people. How many of those people that are there to apply were on your caseload in the last 30, 60, 90 days and are coming back in to reapply? So we do measure 30-day churn, 60-day, and 90-day. I mean, the 30-day is pretty obvious that something went wrong. And I think the thing that's important to remember, most times what that means is these people were eligible, and now they're back on. So that seems like a big waste of time for everybody. And the second measurement that we're tracking, because it seems to be almost half of the reason for our churn, is what we call recertification churn. And imagine your same lobby. You've got 100 people out there. Say 20 are out there that had been on before, so they're in your reapplication churn. Well, typically, at least 10 of those, or half of them, are out there because they had a recertification due and they did not complete it. Now that is one area that obviously shows there's something that we could do to improve that statistic, and that's exactly what we're looking for. How do we improve our churn rate? So measuring churn allows us to identify where we need to make changes. By the time we get recertifications, just wonderful. Maybe then we'll focus on a different kind of churn. But I think measuring it really shows where you're making progress and what is being effective. And knowing that, we've already started efforts to redesign our recertification form so it would just really be basically 2 pages, 1 page front and back, because it became quite obvious that we really needed to simplify that. And we're also, of course, looking at pre-populating and other things, and I know San Francisco has some good ideas there as well they'll talk about. So next slide, please. So to kind of focus on how we were measuring this, I think it really helps everybody when they can see the data. And we kind of set a baseline on what our churn rate was in advance of implementing various policies to see what is helpful. Now, one thing that we do, because we are driving to improve all of our performance, is we developed what we call a county data dashboard, and I have the website located there. And on this dashboard, it is a public dashboard, so you know you really want to look good when it's out there for everybody to see. And it does provide tools and information to counties to evaluate some of their areas and see where they need to improve and where they're doing well, and where, to help inform program decisions. And I think that everybody can see these are the things we're focusing on. This is what we're working on. And although our goal was to increase participation, the dashboard is also a good tool for just kind of increasing performance in other areas, because it really shows these are the key measures that we're very serious about: our timeliness, our error rate. So when I talk about that, next slide, please. What's on the dashboard? Well, we are focusing on our priorities. One of the things we focus on, we can't really measure the participation rate as real time, because a lot of it depends on census data that is delayed. But one thing we can definitely look at is caseload growth. And one thing we've been able to see is our caseload growth far exceeding the average for the national caseload growth. And that is one area that we have control in, and counties can see the effect of that real quickly. We all know what our caseloads are. The other thing that we measure on there is what we call dual participation. So we look at how many CalFresh cases are receiving Medi-Cal, and how many Medi-Cal cases are receiving CalFresh. And that is part of, to measure how effective is the express lane eligibility. So we have tools like that that can really improve that, because on those cases, we have them in our caseload. It's not like we don't know them. So it seems like if they're eligible, we want to make sure they're receiving our benefits. The other thing, of course, we're measuring churn for reapplications and recertifications at 30, 60, 90-day intervals. We also have active error rates and timeliness for both expedited service and 30-day. I don't mention it on here, but another thing we have that is interesting is our average days to approval. So we get a good idea what's happening in that area as well. I know a lot of counties are doing same-day service. Not everybody's there, but it does help show us, when we look at these measures, we get an idea who's doing real well, who maybe isn't. But it also, the ones that are doing well can help guide the path for some of them that aren't. So next slide, please. So then this next slide shows the actual location of the dashboard and what it basically looks like. We actually have, even though I don't show it on there, we have a data dashboard. It says how to use it, but we also have a new thing that isn't on this sheet, unfortunately, but it's also called the dashboard trends, and you can actually pull up charts, graphs, all kinds of data to compare your performance to those of other counties, to the state, and there's also demographic information that will help inform where you're missing people. Next slide, please. So on this, I extracted just a kind of a little bit of the data for kind of from 2013 to show where were we with application churn. So you could see there's the data for reapplication churn, and we were looking at, for total churn over 90 days, varied between 19 to 22%. And then 30 days, much less than that, about half of that. On the next slide, you will see recertification churn, and that was generally between 8.5 to 10%. That's all. And the so it basically, but it had a big spike when we went to implementation of ACA and the semi-annual reporting. I think everybody got really pretty swamped on there, and then that's an easy way to see, what kind of fell off the table a little bit was recertification. So that's one thing that kind of points out when there's a little hiccup in the program. and so that we know that we need to address that. And I think we've seen improvement since then. And next slide, please. The whole focus is really on inspiring improvement. We are able, by tracking it, to see what different policies make a difference. So when we implement our streamlined one-page front and back recertification form, we hope to see big improvement there. And for other ideas that are discussed, and I know one's coming up right next, how does that work, and where do we see those results? So we think that we'll also see some reduction in churn once we're really rolling on our semi-annual reporting, because we know that that's a cause of a lot of churn as well. But basically, this really shows exactly all the things that we're doing so that we can measure and know where we're making progress. And again, I do look every time on who's doing really well. And I go down that list of counties and I kind of call some and say, hey, what are you doing? Because you've got a really good churn rate. And I think that really helps. The sharing of our best practices is one of our big strengths in this state. And we do have counties that are very innovative and always have good ideas. So, next slide. In closing, I'm always continually impressed at the efforts of our county, particularly during the challenging times that we've been through with our ACA implementation, our SAR implementation, all of our heat need, and raising to 200%. We've had a lot of policy changes recently, and they still managed to maintain really good performance. So I'm really pleased about that. I'm hoping that as we attack the churn issue, it will help relieve their workload, reduce client frustration, and lower administrative costs. So I'm always happy to hear ideas for program innovation and improvement, and people are always free to email me with any ideas. So I think that's it for me.
Thank you, Linda, so much. Thank you, Linda, so much. That's a great overview. And we're going to hold questions actually until we have heard from all three of our presenters. So if without further ado, that's a great lead into a county who is incubating some best practices on churn that we hope can become state standards. So Tiana, tell us the San Francisco story.
Hi, yeah. So why don't I just back up a little bit and say that last year we had 4 fellows with a group called Code for America, and they came to work with us on how to improve client experiences, and we asked them to focus on the question of churn and to look into why it might be happening and what it was like from the client experience, and to help us think through how potentially we could help. And on this first slide, I'm showing you kind of one of the final products that came out of the project, which was is a texting service that we call Promptly that we are using right now to send messages to people who are on CalFresh who are at risk of getting discontinued by the end of the month. And we give them this simple one-sentence warning or indication that they might be discontinued and encourage them to call the office. And we're doing it in Spanish and Chinese. So I'm going to tell you a little bit about why we came to that, and then also kind of what it takes and what we've learned so far. So on the next slide, I mentioned that about 15% of people in San Francisco are churning or enrolling and falling off within 3 months. That 15% is, very much of an estimate pulled off of the dashboard that Linda referenced, but I'm just kind of averaging over a couple different months there. So it's around 15%, depends if you're talking about 3 months or 90 days or 60 days or whatever. But we know basically we're having trouble in San Francisco the same way we are in the rest of the state and probably the rest of the nation with keeping people on CalFresh, and we wanted to figure out why. So we had these 4 Code for America fellows, and we had them spend time interviewing many, many clients who are in our lobby, and also going out to community-based organizations and interviewing clients who were applying for CalFresh with the help of agencies. And we had them even go into supermarkets and talk to cashiers, trying to get the full experience of what it was like to be on CalFresh. We had two of them, one of them fully get on CalFresh herself, and this year we've had a second Code for America staff person get on CalFresh themselves so that they could receive the notices and even live on the CalFresh budget and really go through the experience. And part of it was to see what could they understand or not understand in terms of how to maintain their case. One of the things they found in their interviews is that it's at the cash register in the grocery store when clients often learn they've been discontinued. They've gone shopping in the store, they've put things in their cart, they're checking out, and they learn that there's no money left at that point on their EBT. So many of them don't know they're discontinued is one thing that became clear. Another thing that became clear was they didn't understand why they were going to be discontinued. And here I'm saying that mail reminders and processes are difficult. And if you go to the next slide, I can give you an example. So because they were on aid, they received notices of action like all of our clients do. And they and we were really startled to become familiar with how difficult to understand the notices of action are, how hard they are to read, how, small font and lots of information and kind of legalese, and how often the information provided just honestly does not make any sense. So if you look at the next slide, that NOAA says, effective the 1st of January 2013, your food stamp benefits are changed from $200 to $200 each month. Here's why. Your utility cost has changed. When your utility cost changes, the amount of food stamps you're eligible to receive changes, right? And it goes on. And so here's another example. As of June 30th, 2013, the county is stopping your cash aid and or food stamps. Here's why. And as of the 12th of this month, and it goes on. And so they themselves, these fellows who are very bright, informed people, not only found them confusing, but often found that they didn't make sense. And they found that they got multiple NOAAs in the mail, so that it was, they became sympathetic with the idea that people might stop opening the mail or stop paying such close attention because they were getting so many notices that often didn't make sense or were incredibly difficult to understand. So what they decided with kind of our guidance and input was, let's do what we can to do an intervention that would be clear, straightforward, simple, provide in one sentence the information to the client that they were at risk of being discontinued. So they would know before they got to the grocery store. They wouldn't know why from the text, but they could click on it and call our call center directly, or they could just call our phone number manually. And that's the pilot that we've launched, and we are still in the process of reviewing data and trying to understand in what way it's helped, and mostly trying to figure out in terms of continuous improvement what changes we might want to make. So for example, we're talking about maybe sending our message out earlier in the month. Right now we're sending it about 4 business days close to the end of the month. So maybe if we sent it earlier, would we have more impact? Or maybe if we sent it twice, would we have more impact? And we're also considering other types of messages that we could send out. For example, we might send a text to people who are on CalFresh and not on Medi-Cal, indicating that they would be likely eligible for Express Lane, and see what impact we had on that. So basically, they've developed a tool that we think we can use to communicate with clients in a way that's very straightforward. And through our experience, I mean, obviously not everyone has everyone texts, or everyone even has a cell phone. But in our experience, a lot of our clients do. Right now, I'd have to pull the numbers up, but it's something like 6,000 people have, out of our 29,000 people on CalFresh, have already signed up to say, yes, I want to receive text messages. So we know a considerable part of the population is game and interested in receiving text. And we also are just kicking off a phone survey to talk to people who have received the text. And of every single person we spoke to gave positive feedback. They were grateful for the text. They wouldn't have called without it. One woman said, you know, my mail never keeps up with me. I've moved so many times in the past year. I was really grateful to get your text. And another said, I live with a bunch of roommates. It's hard for me to always get my mail. I was grateful to get your text. So if your county is interested, go ahead to the next slide. Your county or state is interested in doing something like this. Promptly is an open source software that other counties or places could choose to, can choose to use it. The way it's worked so well for us is that we have an interface into the CalWin system, and so we can do reports and pull up which names we want, to send texts to, and the Promptly interface will go into CalWin and pull out the phone numbers and so forth, which makes it very clean. If counties and the other consortiums wanted to use Promptly, I would encourage them to pursue or look into the development of an interface there. In terms of an opt-in consent, so we made a decision that we wanted to inform clients that this is an option and have them decide, yes, I'm interested in receiving text, rather than us assuming by default if we have their cell phone number, we could text them. So we drafted an opt-in consent form, and we included emails in it. If you'd like us to text an email, text a message, click here, or check off here, or email, check off here, and so forth. So we would even know for the future if we wanted to do some sort of email campaign, we would already have consent. So we do it for new applications. We use this consent form. For recertifications, we include it in the packet. And we've also done a mailer to our existing caseload with the form to encourage them to sign it and mail it back. Then we also had to figure out what field to store cell phone numbers in CalWin, and how to store consent that they had indicated, consent. And so we ended up using the message field in CalWin and using a special indicator for consent. And right now the CalWin Consortium is reviewing a change request that we've submitted, encouraging the consortium to kind of modify the system so cell phone numbers are more clearly indicated within CalWin, and so there's an opportunity for consent so that all counties could be using the same system and the same fields to include that, collect that information. Now, if you want to send a text out with Promptly, you could be sending out any text, anytime, to any audience. We specifically have piloted this so far with this, target group, but we feel like we haven't even begun to take advantage of this as an opportunity to improve user experience and customer service. So I think this is really the beginning for us. As I mentioned, the express lane maybe being another next step. And we also are doing something with CalWorks where we're reminding people to participate in certain work requirements. Now, in terms of training our staff, it really was very self-explanatory. We went unit to unit and explained the initiative. We showed them the consent form. We made sure they understood what it was in case clients had questions. We made sure they knew which field to put the cell phone numbers in and how to indicate consent. And we just collected their questions as we talked to them and ended up developing a quick FAQ that we made available. But rolling it out is really quite straightforward. And then our next slide. So here's where we are right now. 5,800 people have signed up in the past less than a year. We've sent out 1,200 text reminders in 3 different languages. Of those texts that went out, 39% of those people, receivers of those texts, called the call center. And those callers, those 471 calls that came, we only can track those if they responded to the text we sent them and clicked, call now, and went on, kind of pushed the button and automatically went to our call center. If instead they waited a few days and then called, we can't track them. Because if you, let me just kind of explain this real quick. We set up a way to track respondents by creating a third-party phone number. So if you responded by clicking on the phone, your call was routed to a third number and then forwarded to our call center, and we just did that routing so that we could track numbers of calls. But people, had the opportunity to just call the call center directly, so we think this might be a substantial undercounting. So, but what we do know is at least 39% of people who received the text called and got information. And so we know those people were informed, and we know they took at least enough action to know more. Our outcome evaluation is, our outcome data is under evaluation. We're really trying to figure out what we know and what means what. But in our phone surveys, we've most definitely gotten the sense that people appreciate the clear communication. I thought I might be cut off, but getting the text made it definite. And so even if the quantitative numbers aren't hugely successful, it's clear to us that in terms of a qualitative user experience, this is a good thing for clients. So that's that. I'm done with promptly.
Thank you, Tiana. That is really exciting to hear what you guys have started with it and where you're going to next, both in terms of other uses and other evaluations. So definitely we want to stay tuned. Before I turn it over to Idaho, I would like to remind everyone that we're going to take questions by the chat box on the bar. So if you have questions for Linda or Tiana so far, or just questions about churn in general, go ahead and start sending those along and we'll get those organized. And we'll have an open discussion after we hear from Greg. So Greg, tell us the Idaho story.
Thanks. My name is Greg Kuntz. I'm a deputy administrator here in Idaho, and I've been here about 30 years. And we've been doing work around churn. We're actually entering our 5th year. It is interesting to hear others talk about churn because we have found that it's an area where we can make some significant improvements. And for Idaho, we were looking at ways of making the customer's experience better. We wanted to make sure that we were using data to inform us, making sure we were making choices, because there are so many different things you can do, and sometimes you have some effects you weren't necessarily intending because you thought one thing would improve the way in which the customer would interact or reduce churn. So we have used data a lot, and then we were really looking at ways that we could measure our cost effectiveness. How much does it cost us as a state to operate? So if the family was happy and the family was getting services when they needed to receive services, and the state's costs for providing those services went down, we thought we had a fairly successful approach or strategy. Next page. So the first thing that I want to show you in this slide, I apologize for it being so noisy, but you can go back and look at it in some detail maybe after this presentation. We tried to look at churn to understand it, how it related to all of our programs. So here you have Medicaid, SNAP, and child care. If you'll hit the return button again, we'll look at just the SNAP program. And then the interesting thing is as already has been talked about on this call, there's a reevaluation churn and there's an application churn. And what we realized was different solutions impacted each of those 2 different places along the process. So, and our numbers are fairly small. We're probably smaller than almost every county in California. But this kind of tells the story as of 2011, after we did our first study starting in 2010, that about 32% of the individuals that were due for a redetermination did not complete, 4% were determined not eligible, and 64% actually completed the process and continued. And we had had struggles in the past even getting all of our redeterminations done on time. So we kind of anchored to this view in terms of data and said, what can we do to reduce that fail to complete to 32%? And I will say one of the critical definitions was to make sure we could sort out those administrative actions from those actions where eligibility was actually done, because if you find someone in redetermination that's not eligible, that is the work that should be done. But failing to complete and not knowing why and just not being able to get through the administrative process, that was a problem. Next page. So at the same time we wanted to understand exactly what churn was, we realized that it was really part of a much larger system. And as this slide shows, churn at application and redetermination is something that we focus on both of those. We think we have our application churn down so that less than 1% or around 2% for our Medicaid and our SNAP program actually come back. But we don't, anyone who wants to apply can get through that process. And our redetermination is where our current focus is because we're still at that 32 to 40% level. But we also have these other aspects, and I just, before I jump into the churn specifically, wanted to mention why a solution with churn has to take into account these other factors. One of the early lessons we learned was that you have to minimize the events. You have to make the process fairly simple. And if you create an event, if you create a, this is what we know now, you have to do something in return, that activity of creating that event will cause a certain number of people just to not follow through. So we've done some things like decision making at the first point of contact, where if we talk with anyone on the phone, we make sure we can get that person to a decision maker who can decide, yes, you're eligible, no, you're not, this is what I need, no, that's not what I need. We work with our staff and we say to them, what is it that prevents people from continuing? What is it that makes it hard for them? So our operations drive our business processes. We come back at policy after we've looked at, well, if we could do it like this with our families, then more of them would stay on. Then we look for a way in which we can do a waiver, or we need to modify our policy to make that work. And the other thing we learned, because we deal with multiple programs, is we interact with the family, not the program. So many things that we do are confusing. We had families that would get a notice and it would be for child care, or it would be for Medicaid, or it would be for SNAP. So all of this information was coming to them, and we realized in some of our solutions we really needed to step back and say, what is the family experiencing, and what would the family think if they received this information? And we had several families say, well, we received something saying we have been redetermined, it was child care, so when the next notice came for SNAP, they let it go thinking they'd already taken care of that, and then they closed. And again, we create and maintain performance metrics. We're pretty obsessed about that, and we look at those numbers every single month. Again, we try to make sure that we can make a decision very, very quickly, and whenever we touch a family, we say touch a family only once. No family gets to make the contact in and not resolve their issue at the time we make that contact. What that has given us is the next slide, and I'm just going to talk about this briefly. This is where Idaho was in 2004 and 2005 when we were in trouble with our sanctions for our timeliness, for our accuracy, both in the positive and the negative. Hit the enter button again. What we decided was we had to do something different to measure our effectiveness, and we moved to our costs and same-day approvals and how many days someone had to wait if they didn't get the decision made at the same day. Hit the enter key again. What we've been able to do is produce outcomes that have given us bonuses almost every single year, and hit the enter key one more time. And we're able to maintain that through this year, and we're expecting next year. The idea is if you interact with a family, if you when you have that interaction can support them for what they need at that single moment, then your chances are you will keep them. They will have an access or a method in which they know that if they call and make the effort, they are going to get resolution, and it isn't going to be a burdensome process. With that said, the slide that really makes the difference here are the things that we've done. So next page. What we do for churn. We pre-populate our forms that we send out to customers when we do redetermination. It personalizes it for one thing. It engages the individual, so it's not like some of the other problems where the mail didn't even get to the person. This just encourages them, gives them information, says this is what we know about you, tell us if this is right or wrong, and send it back. That has been very helpful. We also do phone-based reevaluations. We've really focused on the phone. We think almost everybody these days has access to a phone and they can call. We'll take a phone call just about any time. The phone call does not come into a center where it's routed. It comes into a center that we call a processing center where people actually will do the reevaluation right there on the spot. So the process is less onerous, it takes less effort, and you can know at the end of the conversation, because we do real-time eligibility, what the decision is in about 70% of the time. The phone interaction, just because we're not face-to-face or we're doing something with paper, means if there's a question about income, then we can say at that very moment, what is it that we need to understand about income? Some individuals don't complete the redetermination process. They start it, but then they reach a snag. And so we try to limit the effort that's required by the customer in those interactions, and we've actually had training sessions with our staff to say, your job isn't trying to prove that someone has not yet reached the threshold. Your job is to help the family understand how they can prove that they are eligible. And that has been a significant paradigm shift from kind of guarding the gates to assisting the family in documenting and verifying the facts that are true for their family. And now, if there's something we can do to access information or look at other forms of verification, and we do this right while we are interacting by phone, or if someone comes into the office, we attempt to give, and 70% of the time do provide, a decision while they're on the phone and we're live. I've mentioned the minimize the reevaluation event. We think ultimately that is what we must do. We have a long way to go for other ways in which we can learn and make this idea of sending something and requiring the family to do something back, especially if we already know that the family's eligible, and I'll talk about that in just a second. But item number 7 is learning from other programs and policies. The Affordable Care Act for Idaho was a huge challenge and a huge wake-up call. And we are implementing our state-based marketplace on November 15th of this year. We used the FFM last year, but in going through all the policies for Medicaid, we asked ourselves, are there things we're doing in Medicaid that we ought to be doing in SNAP, and why can't we? And obviously there are many things that Medicaid does that you can't do in SNAP, but at least we asked the question and we learn from those other programs and policies, so that if there is the potential of using more interface-driven verifications, we want to use it. And at this point, we don't have it yet, but the point that we are at now, we ask ourselves, we kind of know what we need to do to make it better. We have to minimize the event. What could we do if we were operating like child care, or what could we do if we were operating like Medicaid? And then when we have our conversations in our federal forums or in our regional forums, we say we'd like to be able to do this. Why can't we do this, where we gather interfaces, confirm all this information, and essentially say this is the information that we have that is true, and all the interfaces tell us this. Again, one more step needed to make that possible, but we are focused on that for our future. We are working to improve our notices for the future. We just implemented a new notice system trying to solve some of the same things that have already been spoken on this presentation, where the notice has to be very clear and precise so that a family can understand what it is that's being said. And then we are adamant that the phone systems that we have and connecting to a decision maker is one of the critical aspects. Text may be in our future. We've written down a few notes from even this presentation. But the idea that you have a two-way dialogue with an individual and you can provide a decision at the point in which you interact with that family, we think is really the key to minimizing what that redetermination event requires of the family. And it also helps encourage the accuracy, or it increases the likelihood that your eligibility decision will be accurate when you have that dialogue. So those are the ways in which Idaho has attempted to improve on churn. We do it across all our programs, and we do it at application and redetermination. And we think that as a result of that, we have survived the recession without having some of the challenges that other states have had with long waiting lines. Because ultimately, if customers aren't coming in because they inadvertently drop off, even when they remain eligible, then the state's costs are lower, the family stress and effort is lower. So that's Idaho's story.
Thank you, Greg. That is incredibly impressive to see that arc from 2005 to the present, and then even, as you say, into the future. You're continually improving. We do want to open up. I've got a lot of great questions coming in. Let me see where to start. While I'm sorting all this, I think sure the next slide, just to remind people that we are going to have a third webinar on same-day service, which I thought was interesting, came up over and over again as Greg's cycle diagram shows, is all part of the excellent customer experience. And then again, all materials are posted on transformcalfresh.org. Okay, a first set of questions have come in around measuring churn. And Linda, I'll start with you on this one, which is, you know, as we've all said, when someone comes back in 90 days, you don't exactly, or 30 or 60, you don't exactly know the reasons at this point. You don't know if it was, yes, there are some that Greg showed us that were determined ineligible, but many we just don't, they don't complete that process. So there's some questions about, are there efforts underway to try to break out that churn pool into those who are eligibility-driven churn versus administrative-driven churn? And there's some suggestions here about, Leo O'Farrell suggests looking at economic indicators that could tell you, hey, look, it's a seasonal economy. People's income went up and went down. There's other suggestions about coding. Just wonder what your thought is on the next step for you or for the state or the counties to better understand, diagnose what's happening with churn using the data.
That's a good question. You know, the problem is really getting the data that would help with that. I think one of the things that Greg mentioned that we're real interested in is some of the issues related to notices. And beyond that, well, first of all, a lot of them are confusing. Second of all, you know, there's obviously, they're not adequately communicating what they need to do. But the other thing behind that would be getting the data, which we don't have now, of what was the real cause for the discontinuance. I think that would be helpful. And then to get other information, you know, we'd almost have to ask the person in the interview, so if it wasn't just procedural, you know, what was it? So, you know, I think that the issue is it'd be nice to be able to segregate that, but I think just overall, whatever we do to improve it is positive. And I think that is something I'd be best to work with the counties on, because they're a little bit closer and see exactly the stories they're hearing in that area.
Tiana or Greg, you want to add to the data question?
I would offer a thought, because we were in the same place. It took us about a year to, and we have the C4 system, which is very similar. You guys still have C4, right, in parts of California?
Correct.
And what we did was we mapped the reason codes, the error codes, into categories that said, we think this is eligibility versus administrative. And while it was a little bit daunting to just go through the process, and it's not necessarily perfect, that mapping allowed us to very easily separate eligibility from others. So that was an easy, relatively, first step to be sure we were focusing on administrative actions.
And I would just add that in addition to quantitative analysis, I think it's always important to get as much feedback and insight you can from the clients themselves or those who have been discontinued to understand what their experience was and even their concrete suggestions about what to do better. We've just found that to be instrumental in so many things we're doing over here.
Well, Tiana, that's a great, the second set of questions is about how do clients feel, and again, any of you can answer this, about communicating by text and by phone. I mean, Tiana, you mentioned that so many 5,800 had opted in. Are there people who are opting out? Greg, do you have people who don't like dealing with the phone, or how is the shift to phone and text being received? Tiana, I'll start with you.
Yeah, I mean, I think it's hard for us to know how many people, theoretically all new applicants are informed by our workers about the option to do texting, but how that message is delivered and with what enthusiasm or clarity, I don't know. There most definitely, we can assume, I think, based on the little pilot testing we've done so far, that seniors, a more elderly population are less likely to be familiar with smartphones or texting and that kind of thing. So we don't really know. I mean, I think I can just say that I'm impressed that so quickly so many have opted in.
Greg, how about you as the shift goes from office-based work to phone-based work? What's been the consumer response?
I think early on, the greatest pushback was from staff who said our customers wouldn't like it because they were in offices and they expected, and they were afraid that their jobs would be impacted. So they believed that it wouldn't be something that they would like. I think we've had a great adoption rate. I think we are now like in our third year of redeterminations. So it's pretty much received as this is the thing you can do. It still, requires them to call in. We do have methods that have tried to minimize the time on the phone, like you call in, operators are busy. We do callback numbers so that we will call you back when an operator becomes free so no one has to wait. So we've made incremental improvements with the phone as we go. But fundamentally, everyone has a phone or has access to a phone. So I think it's been really well received. We actually don't have as much online services because we think the phone works better.
Interesting. Okay, another set of questions that I'm going to group together are about policies, that federal or state policies that make this hard. If you had a magic wand and could make some policy changes, and I ask partly because it's important for us to know the constraints you're working on, and partly because the call is made up largely of advocates. But what do you see as the policy barriers from the Fed at the state level that are getting in the way of or making churn reduction efforts a little bit harder?
I think this is Linda, just for my point of view, one thing that Greg talked on that we did ask for a waiver is when we see how liberal in comparison the verification requirements are for the Medi-Cal side compared to our side, we did ask for a waiver to be able to use, if it got verified on the Medi-Cal side, could we use that on our side? We haven't heard back on that waiver, but I think that's an area where, FNS really needs to look at what's happening on the other side, because there was a lot of churn around verification, and that is one area that we've asked for some relief, and that's where I think we could make a lot of headway.
And this is Greg. I agree with Linda. The verification requirements and why we verify the way we do on the SNAP program, I think we've proven with some of the Medicaid and some of our child care program options that we can prove and be just as accurate. So I think using the interfaces differently is one big thing. The other thing that is challenging for us is, having to have the interview and how extensive that interview or that contact is. I mean, today we have phone interviews, but you marry the interface with the ability to act on interface-based information, and I think you have a powerful combination that will essentially remove the churn issue. In Medicaid, we had a 30% churn rate. When we implemented the Affordable Care Act options and choices through our Medicaid program, our churn rate went to 0, or at least 0 to full digits related to churn, because we removed the event because we were working on actual data, and our experience has told us that those people who leave aren't leaving because they're ineligible. They're leaving because they just didn't complete the process.
Mm-hmm. So both the Medi-Cal renewal process and the Medi-Cal verification rules should be looked at for CalFresh use. I did want to, do you have have you had an issue, Greg, with telephonic signature? And Linda and Tiana, you can speak to this too. And again, moving more to the phone, what does a telephonic signature rule do, or how do you work with that?
It was very straightforward for Idaho. At the time we implemented that, I think there were only 1 or 2 other states that had done it. The guidance was very general. We implemented it. We thought we'd have a ton of challenges and problems with linking it to our case management system. We've had 0. I'm not aware of a single case in probably 3.5 years that has come up as a result of the telephonic signature or the problems related to it.
Great.
And we in San Francisco plan on launching our telephonic signature next month, so stay tuned. I hope it's as seamless as it sounds like it has been in Idaho. I also just wanted to say real quick one other thing about federal or state policies that make it hard, and this is less particularly to policies about churn, and I'm more thinking about the whole process of keeping clients well informed and understanding what's happening to their application or their case or their reapplication. Of the people that we interviewed who are receiving texts, all of them requested, could you send us emails with this information? And I think there's a tricky, I don't know if I can call it a policy or just anxiety about privacy and liability and risk in terms of sharing client information. We would have no interest in texting out personal client information, but I think the angst on that topic is so extreme that there's hesitation to even send emails out about anything, like an email out saying the same thing that those texts say, because of concern that the email system is less secure. And it would be great if someone could work on figuring that out. I mean, I know in terms of the Cowan Consortium, they're talking about putting notices online, and I, in my phone interviews, talked with clients about that option, and they sort of said, yeah, but then you have to go to the website. You have to remember to go there to check in. Can't you send emails directly to me?
Mm-hmm. This issue actually has come up as a live one in a work group that the CDSS and CWDA and counties and advocates are in on expedited service, which is, of course, as people know, and we need to get people in emergency need benefits within 3 days. Obviously, faster communication tools like email, calling, texting, as opposed to traditional mail are really important in that context. So I think keep raising that issue of how do these new technologies work in ways that respect privacy, acknowledge people's access to them, the costs in them, et cetera, but follow the consumer. The consumer is saying that's where I get my information. How can our systems meet that? I did want to say a couple, go ahead, Greg, please.
Just really quick, I would say that part of the challenge in creating a holistic solution, we don't have that problem. I mean, we have that limitation, but to those individuals who can get same-day service, in a way, you can almost solve that problem by handing them a notice if they're in an office, or dealing with the decision-making in a different way. So it's not just having technology support the way in which we traditionally make decisions or determine eligibility, but also seeing whether or not your process can be adapted in a way that doesn't require a technological or a more technical solution. So there's a balance there that I think Idaho has really learned from, that doesn't have us chasing some of these other solutions, because the solution sits right with your person interacting with the customer in the moment and asking the question, can I make a decision and have it totally resolved here and now?
And just to add on to what Tiana was saying about the e-noticing, one thing is the way it's supposed to work is that they're supposed to get an email alert if they opt in if a notice has been sent. So that's one piece that would alert them to that. We did ask that, add that question to our application. Are you okay with us being contacted via email about your case? But again, I guess their worry is in that case they'd have to have an alert, but that is one thing that we're looking at. But it is a little bit of a tricky area. We've tried to be pretty careful about it, but we do have a waiver for that, so I hope we can kind of definitely push forward on that. I do know in LA what they're having is a lot of people, they get their notices both ways right now, so they have both. But when you are able to send it via email, it's so much faster, and that's important too.
Linda, we're right at noon, so I'm going to ask you a quick question to wrap up, which is, do you have a projection on when the new research, the 2-page form, will be rolled out for use with clients?
It is ready. I have to double check. Unfortunately, we got a little bit bombarded because we had all those trailer bill items, the 200%, the heat need, and whatever. But I do know that I think it's already gone to stakeholders. I'm pretty sure, and we've had to wait for FNS to kind of get their thoughts on it. But I think that they finally weighed in that the version we have is just kind of like a little bit of like a semi-annual report on steroids, basically. It's pretty much like that. And I think that should be in the next stages of kind of rolling out. I haven't beaten up my staff too much on that because I know they've just really just finished that other, but that is the next thing that should be moving to its final stages. And then we also had a little bit of an issue with the consortia, so we were all ready to go ahead, and we do want them to go ahead and program it for non-assistance cases. But then what we heard from them was, hey, why don't you and CalWorks get together and do one together as well? And we're like, oh, great. Well, that's another big delay. But we're afraid they won't program just the non-assistance one if we do that. And right now, that's about 80% of our caseload. So we are working with CalWorks to see what they could do, but hopefully sooner than later.
Wow, that just gives you a snapshot into what all that goes involved to moving this forward. So thank you. We will commit to everyone on this call. We'll let you know as soon as the state knows, and of course they'll send out ACLs to the usual channels, but we'll help spread the word when that new device comes in. And I want to thank our speakers, not just for covering churn, but for covering dual enrollment, our previous webinar, and for teeing up same-day service, which is, we could see a glimpse of all the great things happening in Idaho, and we'll want to dig deeper on that in November, our next webinar. So thank you to all of our presenters. Thank you to all the participants. On the last slide, I want to, of course, thank our funders who make this great work possible. Please, those of you who had questions I didn't get to, we'll follow up with you one-on-one, and please don't hesitate to be in touch with me or any of our presenters with additional questions or comments. Thank you very much.